So, hi Fiona, thank you for joining me today to have a chat about the questions that we've been getting through our webinars and wider engagement on the NMC Advanced Practice Regulation Review. I wondered if before we started, if you'd like to introduce yourself and tell us a bit about you.
Yeah, sure. Thank you very much for having me. So my name is Fiona Gibb. I'm the Director for Professional Midwifery at the Royal College of Midwives, and I have been leading on the work that we've been doing in the college, supporting the NMC and others on advanced practice in midwifery.
Lovely, thank you. So, as I said at the start, our engagement with midwives and midwifery stakeholders, we've been receiving, as you know, many questions about the review, but also about midwifery advanced practice in general. And as we know, the advanced practice in midwifery is still in its infancy, really, compared to nursing, and the numbers of advanced practitioners we have across the four nations are far less than we have in nursing. So there have been lots of questions about the role and how it fits within the broader midwifery profession. So I wondered if you could just tell me why you think the review and associated engagement around advanced practice and also the review is important for midwives, maternity services and women.
Yeah, it's a really good question. I think, as you said, midwifery is probably a bit further behind some of our other colleagues who've used advanced practice, particularly in nursing. And even across the UK, there are different countries at different stages of implementing advanced practice. So I think we have to sort of take a sense check of where we're at and what's happening in each of the countries. We know that there's different frameworks that take place in each part of the UK. There are some that are multi-professional, that's right across the whole team. There are, England is the only country that has something specific to midwifery. And we also have just some historic variations of how advanced practice has been implemented and used in different areas of practice. So I think this review is well needed to take a sense check and complement the work that's come before it to see where are we at, who have we got advanced practice, what are advanced practitioners doing, but actually where's the gaps in midwifery? How will advanced practice help us in midwifery to progress the profession, but also ultimately to improve the care that we are providing?
Yeah, thank you, Fiona. We've certainly seen from the advanced practice roles within England specifically as the midwifery advisor for England, but equally the other nations, that the advanced practice role is creating a bit more of a career pathway and that opportunity for professional development. Particularly, we're seeing them in response to the complexities element of pregnancy, so maternal medicine and triage. So yeah, as you say, it is creating that opportunity, isn't it? How do you think advanced practice is going to fit within that broader midwifery profession?
Well, I think, you've hit the nail there about saying about career pathways. I mean, I think we can get a lot of information from our fellow colleagues in different healthcare professions, how they've used it. Personally, where I come from is the fact that, midwifery traditionally, we've not had a very well structured career pathway. You have student, you have newly qualified midwife, you have preceptorship. And then we have all these other leadership roles at the other end of the scale when you've got HOMs, you've got DOMs, heads, directors of midwifery, consultant midwives, you've got senior lecturers, you have professors, you have midwifery managers. But there's this kind of gap in the middle where often, members of the RTM come to us and say, I'm thinking about doing something else. I'm not quite sure what to do, or I quite fancy doing that role. I'm not quite sure how to get there. And I feel like advanced practice kind of would really complement what we do in terms of recognise experience, expertise, getting midwives to broaden their knowledge across the four pillars of practice, because that is one common feature of all the UK, is the definition is that influence and impact across the four pillars of leadership, education, research and clinical practice. And I think by broadening that midwives' knowledge, not only are we helping midwives to advance themselves in terms of their career development, but we're also helping the profession. And that can open doors as well to retaining midwives into different types of roles, different settings, whether that be clinical settings, non-clinical settings. And I think that's something we really need, especially when we know there are fewer midwives than we've had before, actually, with postgraduate formal qualifications such as masters and doctorates. This could help us with that as well. So I think it's really important. There's a lot of strengths.
Thank you. Yeah, and you touched on a really important point there. I know I just made reference to some of the more clinical elements, but these roles are very much across the four pillars, aren't they? And we've been asked in the webinars, what's the difference between advanced an advanced midwifery practitioner and an ACP, so an advanced clinical practitioner. And although those two terms are used kind of synonymously, it is that explanation that this isn't just a clinically focused role. This is covering the breadth of those 4 pillars. So yeah, that's a really, really important point. And what do you think the biggest challenges in developing and embedding these roles are?
Well, I think the fact that we're doing these webinars and, talking about it and doing the review, it's become really quite clear that there's a lot of confusion about exactly what advanced practice is. And you've said about even the terminology itself causes a bit of confusion and conflation. And that has been seen not just in midwifery, in lots of healthcare professions that have used advanced practice. We've recognised that there's inconsistent implementation in terms of people. It's been very role specific, and it's how those roles have been used. But actually, we're being quite clear as we're, aspiring to promote advanced practice of being that this is not role specific. This is a level of practice that midwives can demonstrate. So, how that is implemented, how that's recognised can be a bit of a challenge. And that's why it's important to benchmark it. We know that there are workforce challenges. So, how can we support midwives to be able to have dedicated time and support to be able to undertake the education that's required to go on to advanced practice? And obviously things like lack of funding, policy and organizational restrictions. These are all things that will have to be worked through in time. And I know people right now are asking the questions because they say, yeah, but what about this? What about this? What about this? We have to start somewhere, and a lot of these things we'll have to work through, and they'll evolve. We have to sort of have a look to see how it's being done currently, what is working well, recognize the expertise that's already there, but push it forward as well. So these are all challenges, and it's going to take time. And I'm really pleased, and the RCM is pleased to see the NMC really look at this in detail and give it the time to take people along with us, because I think that's what people need to do at this point. They need to discuss and debate and make sure what it is right for midwifery.
Yeah, absolutely. Thank you. And I think one of the things that seems to be coming through as well is that these roles just been developed to plug gaps in doctors' rotas? Are they mini doctors? And I know that's a message that we're sending out really clearly, that this isn't the mini doctors, this is the maxi midwife. So this is still working within that scope of a midwife. But I know we've been having questions, haven't we, around midwives doing cesarean sections? And I think with it, what would you say to that if someone's coming to you and saying, oh, this is how I envisage it?
Yeah, I mean, we've been really clear in the RCM, and it's in our position statement, that advanced practice is not role replacement for medical staff, and midwives should not be undertaking, any skills that are out with the scope of midwifery practice. And I know that probably some of the advanced practitioners, whether that's midwifery or nursing or whatever, they have had experiences of that happening. And I suppose that's always a risk that we need to make sure that that's not something that continues going forward. Now, there may be midwives out there who have done additional training, etc., in something quite specific, but that does not mean to say that that's advanced practice. That's not advanced midwifery practice. You've just done additional courses or training in order to be able to undertake that skill. So that's why it's really important as part of this review to see what are midwives doing and what does that mean? What's that level of thinking? Whether you're in a clinical environment or a non-clinical environment, what demonstrates that advanced practice, and how does that lead on to further things, maybe like consultant midwifery practice, etc. It's going to be tricky.
Yeah, definitely. And I suppose that's going to be part of the NMC regulation review. Will hopefully address some of that with the education standards and the proficiencies. It will create, more of an outline and a basis of these roles for people to have that guidance when they're developing these positions.
Yeah, I think a lot of people ask, is that question, and it's particularly in midwifery, is, that what's the difference? What is it between the sort of what midwives can do when they're newly qualified to what's advanced practice? And really the key answer to that question is we are talking about that recognition of midwifery expertise, the experience, and it's underpinned by postgraduate education at master's level. And that might take different forms, no matter, I know there are traditional advanced practice master's courses, but there could be other ways that people could demonstrate that in terms of, I don't know, if you have a particular area of practice in global health, for example, and you do a global health master's, that all needs to be worked through, that there are different ways to demonstrate that you are working at a master's level. And that to me is that key importance. It's the experience, the expertise, and it's the postgraduate education, which is not something that you would necessarily expect from a newly qualified midwife. They're proficient, but they're not advanced.
Yeah, and as you say there's potentially different routes into that, but it's the level of practice. So during the transitional approach work stream that's going to be looked at as part of this review, it'll be looking at that recognition of prior learning or experiential learning, so that it makes it fair to our workforce. There could be someone that's been working at an advanced practice level for 20 years, but they haven't got the specific advanced practice masters. So, the NMC's approach hopefully is going to be, be very fair and proportionate approach to that transition, because we certainly want to recognise the skills of our current workforce as well as those coming through the training. So,
yeah. And it's interesting going back to what you said about like language and how, we spoke a lot about advanced clinical practice, and it's been really interesting when I've been going out speaking to advanced practitioners. Advanced clinical practice, ACPs, has been spoken about quite a lot. And I think it's interesting that the language right across the healthcare professions, when you look at the Centre for Advancing Practice, etc., again, have that agreement that we're talking about 4 pillars here. So it's how you apply that level of practice to that particular area that you're working in, whether that is in a clinical environment, or whether it is that you're in an education environment, or you're a researcher, or perhaps you work, in sort of strategy and policy and leadership, etc. So I think that's a really important thing, that this is not going to look exactly the same for everyone in terms of how they apply it. It's that level of practice and how you apply that to your practice. It's a bit like as a newly qualified midwife, they're proficient in all the domains, they're there, but we don't expect them to be using that or applying that to the practice every single time. They'll use the skills that they need in order to, work in that particular sphere of practice. So, I think if we can get into our heads that this is a level of practice for midwives to, work towards, achieve, and then what that will do for them going forward as well in terms of that opportunities for future development.
Lovely, yeah. And I think one of the other questions that we've been asked quite a lot is, when we're talking about levels of practice, is that comparison towards consultant midwives. So people saying, is it an automatic progression? So you have to go through that point of advanced practitioner to then a consultant midwife. And then equally, what's the difference between advanced practice and consultant level practice? I think that's something that we've heard quite a lot, isn't it?
Yeah, and it's a really good question, and I can understand why there's a lot of apprehension about that. I mean, really, the way that kind of we see it, and certainly having spoken to a lot of other healthcare professionals in different areas, they're not mutually exclusive. Yes, a consultant midwife could be an advanced practitioner to help them move on into a consultant midwife role. They don't have to be, but that is one way that they could go. And whereas advanced level practice could be seen at master's level point of thinking, many people will see consultant midwifery as being more like evidencing that doctoral level thinking. Advanced practice might be quite, quite specific. It might be something on quite, focus, whether it's on direct care or a particular part of your practice, whether you're in education and research. Whereas consultant midwives, they tend to be much more in a clinical setting. They will typically sort of focus broader things like system level improvements, leadership, implementing policy, influencing clinical governance. So to me, I see that at a different level. But I know that consultant midwives in themselves, and you look at the literature, they have their own challenges in terms of how that role, and they're expected to do things that perhaps wasn't where that role came from. So it's not like where one role ends or level ends, another begins. There will be some overlap, but I think they complement one another in order to basically promote leadership and excellence in what we do. And like I say, it's very similar. Specialist practice comes up quite a lot as well, about specialist midwives and are they advanced? Again, they could be. because they could be midwives that could evidence that level of practice. But likewise, you could have a newly qualified midwife who goes straight into an infant feeding role that might be working in that specialism. That doesn't necessarily make them advanced. So I think this is why it's really important that we benchmark it so that people can evidence what it is that they do to demonstrate that they're working at that level.
Yeah, absolutely. And I think, again, there are various consultant frameworks across the 4 countries, aren't there, as well as the advanced practice frameworks. And I think the key thread is that consultancy pillar. So you have your 4 pillars, and then that's built on by that consultant level pillar. And I suppose the roles tend to be, as you say, massive variation, but they tend to be a bit more strategic, don't they, rather than the advanced practice roles. So and as you say, with the specialist midwives, that's another question. And there might be, as part of the transitional approach, as you say, there might be many specialist midwives that would meet the the proficiencies and that advanced level practice. So yeah, I think just talking about those kind of educational pathways and that career development, what are or what could the educational pathways look like for midwives moving into these advanced practice roles, do you think?
Yeah, I mean, I'm sure this will generate lots of discussion, and I suppose it's important to say in everything we're talking about today, nothing has been said. We don't know exactly how this is going to play out. This is part of the discussions in terms of how we support people with that. I mean, I know, speaking to advanced practitioners, and again, I've spoken to people in different professions about it, the sort of more often role that you see is that people have gone on to do an advanced practice master's of some sort. Now, generally, they're not often role specific. They'll have to be advanced practice. There'll be a series of modules, and then it's how you apply the content of those modules to your scope of practice, whether that being leadership, etc. Interestingly, prescribing is a module that comes up quite often as well, that prescribing is part of that advanced practice. And sometimes that's the instigator that leads people to go and do a specific advanced practice course if it includes that module. But, if we're trying to be aspirational here and we're looking at different ways that we can support midwives to develop in their career, and it's one of the most often asked questions we get in terms of, what can I be doing? If I want to see, if I see myself going forward and doing that. Now, it could be that, yes, other master's level education is available. And as long as people could demonstrate how that matches to whatever the advanced practice benchmark would look like, that could also be included. It has to be relevant. Clearly, you couldn't have like a master's in something completely different from midwifery that you couldn't apply to your scope, and that would all have to be matched out. And then there may be some people out there that think, do you know what, actually I am working in advanced practice level, I have done X, Y, and Z, I can demonstrate how I influence and make impact across these 4 pillars, and in which case looking at things like portfolios of development and evidence, that could also be recognized as well in terms of how people demonstrate that. I know in nursing they've explored things like credentialing, etc. And these are all things that need to be discussed, and what the pros and cons are, and recognizing that with access to education and training, there are barriers. We've mentioned some of them already in terms of how you access these courses, where they are, when you access them, the money that they may cost, the funding that needs to be behind this. So, we're not naive in this. I think it's a whole different thing outside of this review is looking at that clinical governance structures and organizations to support this. But yes, I mean, we're all up for, answers, aren't we, Romie? I mean, if people have got ideas, it's part of this discussion,
Absolutely, and I think that's an important thing to note. The NMC review is still very much underway, and this is a work in progress. As you say, nothing's been decided at this point. There's a lot of engagement going on, and I would really encourage anyone that's interested in finding out more to join the NMC community of practice for advanced practice. And absolutely send over, any thoughts that they've got to the advanced practice website. That's advanced practice email address that's on the website, because we really like to hear the views of people, because it's so important, as we've seen from the engagement. But also the webinars that are going to be available online as well, I think are helpful for people if they've got questions and want a bit more clarity around the role. And obviously there's the RCM as well, isn't there?
Yeah, this is a piece of work really in the last year that we've really gone into in more detail. The position statement came out last summer, and it's there on our website. And of course, we're working very closely with you and the NMC, and I represent on the steering group. And we've been discussing with members and really just gathering information and experience as well from, there are many midwives out there who are advanced practitioners. So let's learn from what has come before, and then also identify gaps and be aspirational about what it can do for the profession, and be recognised as well right across our multi-professional colleagues who also have these opportunities available to them.
Absolutely, and there are some advanced practitioners out there doing amazing jobs, and have really helped to strengthen that multidisciplinary team working. So yeah, we know that these roles can work really well and fit as part of the wider team. So yeah, that's great. Is there anything else that you wanted to discuss, Fiona? Anything else that you want to cover?
I suppose kind of just like looking forward, it is a bit of a passion of this work is, some people have asked me, well, it has been used mainly within that clinical sphere. What do you mean when we say that midwives in clinical and non-clinical settings could be working to this level? And I suppose that's where the aspirational thing for me comes in. In the RCM, we've been very, very concerned that we're seeing fewer researchers, we're seeing fewer educators. We know that we've got brilliant leaders out there, but we've also got leaders who are sometimes going into positions that they don't feel ready for, or they don't feel supported, or they need additional support. So I really could see advanced practice as being, a help for all of these issues that we've got. And we'll explore different ways, for example, that a midwife, whether conducting research or, developing curriculum, for example, would evidence that they're working at an advanced practice level. And fingers crossed, in future, that means that we will see that greater expertise of knowledge right across these 4 pillars, rather than just seeing it as just one pillar alone. And I know for some people that will be tricky. It's not what we've done in the past, but I think it's worth a conversation to see where this can go.
Yeah, absolutely. As you say, plenty of opportunity. Well, thank you, Fiona. It's been great talking to you. And as I said before, there's lots of resources on the NMC website if anyone would like to find out any more information. So thank you.
Thanks very much, Romie.